Well, good morning, Santa Clarita. I thought it would be appropriate to connect once again and provide you an update of the council's actions from last night, as well as provide some data on, after having 2 months worth of statistics and data about the virus specific to the Santa Clarita Valley and the city of Santa Clarita, and provide you an update of what this data is showing for our community and how we used that to inform our decisions and our actions last night in response to the county's announcement that the stay-at-home order is going to be extended until July 31st in some fashion. So first, some high-level data. The latest numbers have the county total cases at over 33,000. Here in the Santa Clarita Valley, those numbers are at 794 as of yesterday and 507 here in the city of Santa Clarita. As I've mentioned before, it's important to keep these numbers in perspective. These are not active cases. These are total number of confirmed cases since testing began in early March. So in the city of Santa Clarita, there have been a total of 507 positive cases since we started testing in early March. Also, it's important to note in the Santa Clarita Valley numbers, that now includes a number of positive cases at the Pitchess Detention Center. Well over 100 of our total cases in the Santa Clarita Valley can now be attributed to the inmates at Pitchess. In fact, yesterday's numbers showed a spike of 50 new cases within the Santa Clarita Valley. However, 37 of those 50 were inmates at Pitchess. So clearly that population is not out amongst Santa Clarita residents. They're not visiting are going to our grocery stores. They're not in our community. They are in a controlled, isolated environment. So while those numbers are being attributed to the Santa Clarita Valley, it's important to put them in the proper context. I know one of my frustrations, and I think many of ours, has been in the reporting of these numbers. Many of the times it's being left out, the numbers of recoveries. You know, we're only showing the raw data of 33,000 plus in LA County have tested positive. Well, how many of those have now been cured, if you will, or no longer have the virus? And why don't we show some of those numbers? So to the credit of our local newspaper, The Signal, they put together a chart here specific to the Santa Clarita Valley that shows just that. If you look at the green bars, that is the total number of patients that have been recovered and released from our local hospital. The blue is the number of patients that are currently hospitalized. So you can see as the trend increased from late March into April, we had our peak hospitalizations right around April 17th, 18th, and with fewer recoveries. But now you fast forward to last week, and the numbers this week are very similar, that has really flipped. So at this point, we have roughly 17 confirmed hospitalizations with nearly 60 confirmed recoveries. And so those, you can see the data is much more positive, and I think that is really applicable countywide, but here in Santa Clarita, you can see how our community has responded, that we are currently at, again, 15 to 17 current hospitalizations with nearly 60 recoveries, as showing that we are making tremendous progress. The next slide wanted to compare the total cases. So we're doing apples to apples here. The total number of cases in Los Angeles County versus the total number of cases here in the Santa Clarita Valley. And again, this is not active cases. These are just those confirmed cases. So again, you look at the blue line is for Los Angeles County. And that number is, since the slide has been done, that number has exceeded the 30,000 population number. But the green, if you can even see it, represents the Santa Clarita Valley line of less than 800 cases. So again, when you see it, you can see the Santa Clarita Valley is accounting for such a small percentage of the total number of cases in Los Angeles County. And we look at fatalities. Again, as of yesterday, there were 1,613 confirmed COVID-19 fatalities in Los Angeles County. 7 of those are attributed here in the Santa Clarita Valley, as reported at Henry Mayo. So again, you can see it as a small percentage of those fatalities. It doesn't minimize the loss of life and the impact that has on those families who have lost loved ones, those who weren't able to see them before they passed away, or having impacts on their ability for burial services. It doesn't minimize that whatsoever, but we want to put it in perspective after 2 months of what it looks like for Santa Clarita as compared to the rest of Los Angeles County. Again, we also track day by day cases as those are being released. And this is for the city of Santa Clarita, so that's a little bit different than the Santa Clarita Valley. But as you can see, the orange graph, the orange bar, is the daily confirmed cases in Los Angeles County. And the blue, if you can see it, are the daily cases in the city of Santa Clarita. Basic numbers show that over the last 2 weeks, Los Angeles County is averaging around 800 new cases per day, and the city of Santa Clarita is averaging around 11 new cases per day over the last 2 weeks. So again, giving you a more detailed breakdown from what the graphs show. And again, as you look at, so what does that, how does that translate? In the city of Santa Clarita, we currently account for 1.6% of the total confirmed cases in Los Angeles County. And is that the last of, and so that is the last, sorry about that. So that's the last slide. We will post all of these on the Santa Clarita emergency.com website for you to look at them at more detail as you wish. But I thought it was important to, again, show the positivity of the work that's been done here in this community. I see overwhelmingly members are following the guidelines of social distancing, of wearing facial coverings when visiting essential businesses. People are following the rules. And over the last 2 months, Santa Clarita the numbers have shown that our efforts in Santa Clarita have paid off. But the reality is, it hasn't been without a cost. The city of Santa Clarita has been identified as the third most impacted city in California in terms of unemployment as a result of the shutdown. We are ranked 17th in the nation for most impacted city as a result of this shutdown. And it is important that we take that into consideration as we look and move into the next 30, 60, 90 days of our future. my last briefing, we had talked about the impact also to the state budget or the city budget, and we are now looking at least for a minimum of a $10 million reduction in city budget, which is clearly going to impact our services. Fortunately, the city has done a great job in years past of preparing for this, so I think we can absorb a hit of that size in the short term. But if the lockdown or if the shutdown continues to extend, the concerns get even greater for not only Santa Clarita, but the state of California as a whole. So I wanted to share this because I wanted to provide some context for the council's actions last night. As many of you are aware, yesterday morning, the Los Angeles County Public Health Officer announced that there was an expectation that the stay-at-home order would be extended for another 75 days until July 31st. Now, we expect today that there will be some context around what that extension looks like, but it is clear that extending a lockdown order for another 2.5 months will continue to ravage the economy of not only Santa Clarita or Los Angeles County, but California as a whole. The state of California is already facing a $50 billion budget deficit, and with Los Angeles County being one of the largest economic drivers for the state, continued decrease in economic activity will only further impact our state and our region. So the City Council voted last night to do several things. First, I want to thank the well over 600 people who called or emailed me and the rest of the City Council voicing your concerns about the extension of the lockdown and urging us to take some action. And so to my knowledge, the city of Santa Clarita is the first city in LA County to formally oppose the health director's order to extend the order to another 75 days. Nobody is saying that communities should be reopened automatically and go back to pre-COVID circumstances, but to not provide a roadmap, a guideline for communities, businesses to plan for how they can reopen and protect their employees, protect their customers, and in the city's case, continue to provide services to our community is just untenable. And quite frankly, based on the numbers here in Santa Clarita, are difficult to justify. So the council took two significant steps last night. First, we will be transmitting a communication. The idea was to pass a resolution. We can't, because of open meeting laws and timelines, we can't do a formal resolution, but it's a matter of semantics that we will be communicating to the Board of Supervisors, the city's opposition to the health officer's order or announcement yesterday, and urge the county to provide tangible, attainable benchmarks for residents and businesses and local governments to begin the reopening process of our communities. We also are going to petition Los Angeles County for a waiver. What we're about to see is a number of counties and the state of California are going to be in conflict about opening orders. The governor has the authority by law to declare a public health emergency and then set standards for how that emergency is going to be responded. He is delegated to local counties or cities that have their own public health department the ability to be more prescriptive or put more regulations on their jurisdictions. You can't be less than what the state does, but you can be more restrictive. And what is going to happen, I believe, very quickly is Los Angeles County and others are going to be in a position where their order is in conflict with the state. And that's going to put communities like Santa Clarita, Antelope Valley, Palmdale, Lancaster, Burbank, other communities in Los Angeles County in a difficult position, because you're going to have the state outlining a set of orders, and you're going to have the county of Los Angeles having another set of orders. And it's going to force people to make a decision on whether or not they are going to be following state law, but then be in conflict with the county law and could be subjecting themselves to some type of enforcement. So what we're going to be asking is for the city of Santa Clarita to be granted a waiver, given our data, that once the time comes for the state and county orders to be in conflict, to allow the city council to determine for our community in a public hearing, at a public vote, which order we wish to follow. If we believe that the state order is, and the state laws are attainable, and we can continue to follow, we can follow those while maintaining safety for our residents, we would like to do that. If we feel that we're not ready and we need to still be under the more restrictive orders of Los Angeles County, we would have that authority as well. But we are going to ask for a waiver, if you will, to give the city of Santa Clarita that flexibility, given our data, our ability to handle any capacity issues at our local hospital, and our continually steady and low numbers of cases. We are also going to, a little bit longer term, we are now going to reach out to the other cities in North Los Angeles County, primarily Palmdale and Lancaster. The purpose of connecting with those two cities is to discuss developing a regional approach to reopening our communities. The North County cities of Santa Clarita, Palmdale, and Lancaster is a population of roughly 600,000 people, which would put that region, make us one of the top 20 plus populations in the state if you go by county. So Santa Clarita, Palmdale, Lancaster together is larger than over 30 different counties here in the state of California. So we think it's an opportunity to create a regional plan that we can submit to the governor and ask for a variance for our region. The governor has already approved a variance for 7 different counties in California who want to move faster than even the state order. And the governor laid out very specific criteria for counties that wish to do that. And if they meet them, they are granted a variance and the ability to move at a greater pace. So we feel that it makes perfect sense that if the governor is allowing these variances for counties, why not allow a similar variance for local cities that have that can meet those same standards and that can have a population, again, greater than many of those counties already. So that is something that we are going to discuss about with our neighbors to the north. We already have coalitions with the Antelope Valley on a number of other regional issues, but clearly not every city, not every county is built the same. When the public health officer was asked, why doesn't LA County do what other counties are doing? And the response very appropriately was, well, not every county is the same. And we understand that. Los Angeles County has well over 10 million people. It's the largest county in the country, 88 different cities. We have regions from the beaches to the mountains to the deserts. So it's hard to say that the entire County of Los Angeles should be treated the same way, just as not every county in the state should be treated the same way. So we're going to look to partner with the North County and create a regional approach to how we can safely and productively look to reopen our communities. This regional approach is one that's being taken in San Diego. The city of San Diego and the county of San Diego have joined to ask for a regional variance. The County of Riverside has talked about putting a coalition together as well. Some northern Bay Area counties are working together, some other Northern California counties. So it makes sense to look at this as a regional approach, and we plan to do that. So please continue to stay tuned for updates on how the county receives our request and how our approach and our outreach to the Antelope Valley cities is received as well. So what is open now? This is per the county. As of Friday, the county moved to, again, expand the term of or release some non-essential businesses to allow for curbside pickup of bookstores, clothing stores, florists, music, sporting goods, stores that sell toys, as well as car dealerships and car dealership showrooms. The county also on Friday reopened golf courses and the trails, and there has an announcement, I believe today, beaches are beginning to reopen in Los Angeles County as well. What does that mean? So where are we here in Santa Clarita? As I've said before, Santa Clarita never closed our parks. We never closed our trails. And even by doing that, you go back and you look, it didn't create a spike in cases or a spike in hospitalizations. Our numbers for the last several weeks have remained very steady despite opening up, keep maintaining our parks and trails open. And that's because the residents of Santa Clarita have followed the protocols, have maintained our social distancing, worn facial coverings as needed, and we have not seen a spike as a result. So in addition to our parks and trails being open, the city's tennis courts are now open, and we have reopened the restrooms at our city parks, and they will continue to be cleaned aggressively and to the CDC standards. So Santa Clarita continues to make progress. And in fact, on Monday, May 18th, City Hall will be once again open to the public to allow for residents to access city services, whether it means permits or signing up for or registrations, any city services that you were able to access here at City Hall. They will once again be open. There will be very clear safety protocols in place. Again, the wearing of facial coverings it would still be required. Social distancing needs to be maintained. We ask if you do feel ill to not enter the building. And again, if you are seeking a permit, we still encourage you to make an appointment, which then helps keep the traffic flow at City Hall moving and help with the social distancing requests. And lastly, we ask that you continue to move forward with and participate in the city's Hearts for Heroes program. Last week was National Nurses Week, and the city joined with a number of our partners with law enforcement, our fire department, our frontline workers to thank our nurses and our staff at the hospital. We know that every day, just 1 week, we celebrate our nurses and our frontline employees every day, and they should be celebrated every day. But to have National Nurses Week set aside for those frontline heroes was something special, and we do want to continue to appreciate and acknowledge them. I want to thank our community partners who continue to provide meals and support for our first responders, for our frontline workers, and to our first responders. Last week, our law enforcement did a speed enforcement program, and we need to really be conscious of the speeding within our community. Because there are fewer people on the roads every day does not mean you have a license to speed. That many of our traffic collisions and accidents that we're reading about are speed related, and it's really critical that you continue to follow those rules of the road. Also, please remember when you're visiting city parks or city facilities, social distancing, facial coverings at our essential businesses, all of those still remain in place. And as I mentioned, to our city's efforts to develop a Santa Clarita specific plan, it will still involve safety protocols that have been set by the state. Santa Clarita cannot go beyond what is already set as a baseline for the state of California. And I just want to give one final example, and then I'm happy to take questions. Last weekend, the city of Oceanside, a council member distributed a letter stating that it was his belief that these orders were unconstitutional and that businesses should be able to open, and this council member encouraged the businesses to take that steps. Well, one of the businesses that chose to follow the council member's directions did open up, and very shortly thereafter was visited by the Oceanside Police Department. He was put in handcuffs and was cited for operating their business illegally. And this is what we want to avoid. I know that many of the emails I have received and the council's received have asked us to do just that and declare Santa Clarita open. We cannot do that per the law. And if Santa Clarita did, my concern is that the very businesses that and very residents that we're trying to help would be put in jeopardy of losing their license. If you are a hair salon or you have a liquor license from the state, a restaurant, and you open up because the city told you could, despite not having the authority to do that, you can be subjected to enforcement from state or county officials, and we don't want to do that. We want our community open, but we need to do it within the parameters of the law so that we can continue the progress and open safely and as quickly as possible. And that's why we're trying to take a regional approach and use the data that we have in front of us to help make our case, because if you do look at the data, it certainly shows that Santa Clarita has done our job, and we have flattened the curve. We have stabilized our numbers. We have capacity at our healthcare facilities. And if we open up slowly and responsibly, we can get our community back up and running without causing any or creating more concern for our creating a greater push of residents that could be subject to health concerns. We feel we can do it safely, we can do it appropriately, and we just need to be given the opportunity within the law. So I'm happy to take questions, and let's do it.
Thank you so much, Mayor. Brandy is asking about the letter that the council is going to send to Los Angeles County. How quickly do you expect that to be completed?
The intent of sending the correspondence to the county is to get it to LA County before the board takes action on their on their stay-at-home order. The order expires on the 15th, so we hope to get a letter out today. Quite frankly, if we can turn it around and get it transmitted to the board today. If not, I would imagine it'll be there before noon tomorrow.
Thank you. Laura is asking about Parks and Trails being opened, and I think there's some confusion about LA County trails versus Santa Clarita trails.
So at this point, all trails within the Santa Clarita Valley are open. Because the county has opened up their trails, city never closed ours. So at this point, the trail systems are all open. I do not believe the county has opened up their parks yet. So, but our city parks remain open. But when it comes to trails, whether it's Ellesmere, Towsley, anything on South Fork, any of the trails within the Santa Clarita Valley, they all should be open as of last weekend.
Brandy is asking about graduation ceremonies. Is there any chance that there will be an in-person graduation? So anything regarding the school system, graduation, when schools will be open, will there be fall sports for our schools? That is not under the city's purview. Those are all decisions that are either made by our local school boards when it comes to graduation, and the other issues up by whether it be when the start date or fall sports will be done by other governing bodies. But ultimately, that's a better question for the Hart School District and any of their elected board members. Francesca is asking if kids can play at city parks.
Kids can play at city parks. The play structures still remain closed for now. As you can imagine, that's still with all the touching and use, it's hard to keep those surfaces clean. But yes, kids can play at city parks. But again, it's advised that you stay within your family cohort, so you can play with your siblings. And if you see other families or other residents using the parks, you still need to maintain that social distancing. But it is not required to wear a facial covering on our city parks, and they are open for use. There is no organized sports yet, so you can't have your soccer team or your baseball team having an organized practice. That would still be a violation of the state and county orders. However, the parks are open for play. You can play catch. You can do batting practice with your family. That is still accessible.
Risa is asking if we have enough PPE or personal protective equipment to support a possible future pandemic at our hospitals.
At this point, we are in constant communication with our healthcare professionals, and at this point, it is expected that we have the capacity to manage not only what we have now, but if there is an increase, there is sufficient, I believe, PPE and staffing in place. Obviously, the concern always is that equipment does eventually run out, and I think that was the whole point of our initial stay-at-home orders, was we didn't want to overload the hospital systems throughout the country. But fortunately, that has not happened, and it's enabled a lot of communities to stockpile additional PPE as well as ventilators and others, and be prepared if there is a bump in or a little bit of a surge in cases. But at this point, we are in very good shape with our healthcare providers.
Mallory would like to know, how quickly do you think we will have an answer to if we are able to start opening up or if we have to remain closed? So
I expect this week Los Angeles County will outline an amendment to their stay-at-home order, because that does expire on Friday. So the county does have to take some type of deliberative action to extend it. They can amend how what that's going to look like, and it certainly is our hope that the county will lay out specific, attainable benchmarks for communities to react. And one more thing I want to add from our council meeting on Tuesday, or from last night, is we have directed our city staff to bring back our rent protection ordinance. The council had passed a rent protection ordinance in March to cover the months of April and May. It expires May 31st, so we need to bring that back to determine how whether we want to extend it. The county has added an overlay for rent protection, so we're going to decide whether do we just adopt the county's ordinance or do we do one specific to Santa Clarita. But we realize that as the stay-at-home orders continue to be in place, that has only worsened the economic condition of many of our residents and put their raised their concerns about housing. So we're going to be bringing that up on May 26th, so to determine how we're going to continue to protect our renters here in Santa Clarita. Because again, people shouldn't be losing their homes because the government has told them they can no longer work.
Anthony is asking, are you concerned about protests happening more now because of this?
I think, I don't know if I would say I'm concerned, but certainly the reaction that we saw here at City Hall to the health officer's order or comments yesterday, if that was indicative of what was seen throughout Los Angeles County, people are definitely concerned. And I think people very willingly understood the need for the initial stay-at-home order to, again, flatten the curve, to not overwhelm our hospital systems, to protect our most vulnerable. And Santa Clarita has done that. And in fact, we do not have any members of our homeless community that have tested positive, despite the city partnering with Bridge to Home, our primary homeless provider, services provider. We relocated many of their clients to the city's community center so that social distancing could be observed and proper, and they would have access to a proper hygiene. And as a result, we have not seen one member of our community who's experiencing homelessness test positive. And so we have done much of that work, and I think it took people by surprise to hear that the county was considering extending this until the end of July. And so, again, based on the communication we received here at City Hall, I'm sure that was a county-wide response. And hopefully the Board of Supervisors heard that and will take appropriate steps.
Thank you. We have a couple questions about community pools as well as youth outdoor sports.
So I'll do youth sports first. At this point, the city is still evaluating whether or not we can proceed with city sports in the fall. I think it's pretty safe to say that our summer programs are not going to be happening, because at this point the state has still not allowed for gatherings really beyond your family, or if you are in a daycare setting, you can stay with that group of kids. So I don't expect that gatherings to be allowed, certainly through the summer. We hope that those numbers maybe will be lifted come the fall, that we can resume with our fall programs. The city's, we know the city's flag football is very largely populated. Obviously AYSO and club soccer, our city's volleyball all of those programs are a key part of our community. So we're still waiting for some guidelines on that. Community pools. Pools are closed right now, again, because of health department orders. It is not the city's discretion to open community pools. We hope that they will be in the next phase, and our pools can reopen. You may be hearing about City of Long Beach. I have heard reports that they are opening up their community pools. Well, the City of Long Beach has their own health department. separate from others, and so that gives them the ability to make some decisions within their city. So we are still waiting for some direction from the state about the issue of gatherings that would then help inform our decision about youth sports and community pools.
Jill is asking, will your waiver request include opening churches?
So the issue of again, churches, are and places of worship, I think are an important part of every community. Any waiver that we ask, it's important to remember that we still have to either be in guidance with the state. So the governor has outlined orders around churches and places of worship. However, if we are able to obtain a waiver that would allow us to accelerate a little bit more than other counties or communities because of our data, we would certainly look at the issue of gatherings, again, whether it be churches, for youth sports or youth activities, how would we be able to put those in place for our own community? So it certainly would be considered because, again, it makes sense if you can be in a position where social distancing can be practiced, safety, sanitization, all of that can be handled. I think we should start having those conversations.
Dawn would like to know if our city can get their own public health department.
So we actually had that discussion a little bit last night. I raised that with the city manager, and I think it's something that we would consider as possible a regional approach. The counties of Yuba and Sutter share a health department, and so they have one health official for those two counties. And so possibly creating our own within a regional approach so that we could have maybe a North County health officer, because again, the issues of air quality and others are different here in the north part of the county than the rest. So is it something we would want to do? It does create a whole new level of bureaucracy, and so there are costs associated with that. And given the budget concerns that we're all facing, it may be difficult to do now. But I think it's worth having a discussion, given the fact that Long Beach and Pasadena both have their own health departments. It might be something that we could do regionally.
Thank you, Mayor. And we'll wrap up with a comment from Scott. He says, thank you, Cameron Smyth and the entire City Council for doing what you can to reopen our community. I've been in business here for over 40 years, and this is the first time I have been in survival mode. And when we reopen, I will be in revival mode, hoping to bring back my customers and employees and work towards thriving again one day. I am proud to be a small part of this great city and thankful for the leadership we have.
Well, I do. I just want to say thank you to Scott and the literally hundreds of businesses, small businesses that even during this most difficult time are providing services to nonprofits. They're still looking for ways to help their employees, to help their communities, and that's really what Santa Clarita is all about. I mentioned this a little bit last night at the council meeting, and we've also received a number of requests about shouldn't the city consider creating our own county even, or breaking away. And I've enjoyed those questions because it's enabled me to tell people a little bit about Santa Clarita's history. And the reason why we are a city actually stems directly from efforts from our city founders that wanted to create our own county. One of our initial city council members, Carl Boyer, former history teacher, had created this effort in the late 70s, and there was discussion about creating our own county. And over the years, it transitioned into cityhood, which has then created the great community that we all live in today. And we still continue that independent spirit. We moved away to create our own city because we wanted to be able to make our decisions here locally, and the examples that we're seeing with the data and the community's response to the COVID-19 shows that our community can be responsible. We will follow the guidelines, and as a result, our community is better for it, and therefore it makes sense for Santa Clarita and possibly other parts of the county to be given some flexibility, because not every part of LA County is created in the same, and we all have different challenges and circumstances. And because of the data that we are seeing, I firmly believe Santa Clarita can open up slowly, safely, and responsibly. Thank you.